The support group really came about largely because of Sherman McGraw, who I operated on 13 years ago for Cushing's disease.
After my surgery, Dr. Kelly and I discussed starting a support group, and within that year, we actually had it going.
The purpose here is to give you all more information and a little camaraderie for what you've all been going through. And it really provides an arena to get more education about their disease and to share their stories with each other.
All the people here are so warm that I was able to get like, oh yeah, oh that person went through something like me, and they would hook me up so that I would be able to talk to a person who was going through the same thing as me.
Patients don't know who to turn to, who to ask questions about. The pituitary gland is known as the master gland. It is probably the most important hormone gland in the body.
Because pituitary tumors patients are very alone, and they have usually had quite a road before they ever got a diagnosis. And here they know they're not alone. Our doctors understand what they've been through.
So about 17% of patients have some sort of abnormality of the pituitary gland.
He doesn't dumb it down, he doesn't talk over their head. It's really information that they can understand and take with them to really get their lives back.
And I think all of them find the support group very helpful, and they in turn are helpful to other patients who are searching for support and additional education.
He also talked about the different types of procedures, using the endoscope versus the microscope, something I didn't know about, and also the remission rates and what patients should expect, after surgery.
They're more into not just treating an illness, they're into making sure the patient is taken care of, the whole patient, and that's where the information really helps.
Our doctors understand what they've been through, and I think the biggest thing that makes me feel good is when they give me a hug afterwards and say, I don't feel so lonely. This is the only place I feel normal, and I think that's really important.
When you're talking about something as scary as brain surgery, you need really nice people you trust who can make you feel like you're at home.
As surgeons, we see a small slice of what patients go through day to day. We hear their story, of course, we know how they do every year when we see them, but really to get an understanding of what their life is like, what their difficulties are with their conditions, how they struggle with this, it really opens our eyes and allows us to better take care of them when we do see them.